Most people think Medicare Advantage is the easiest choice and they will stay on it forever. Then the reality shows up. Copays increase. Doctors leave the network and prior authorization slows down care. By year 3 or 4, many people realize Medigap would have been simpler. In this video, I walk through the 5 reasons people switch from Advantage to Medigap. Costs that keep climbing, networks that shrink, health needs that change, underwriting rules most people miss, and billing confusion that catches people off guard. So you understand these issues before you deal with underwriting. If you want Medicare explained clearly and in an honest way, subscribe and follow along. Let's start with the biggest one. Costs are the number one reason people switch. Advantage looks simple at first, then the copays add up. If you see a specialist 3 times a month and they charge $50 a visit, that adds up to about $1,800 a year, before imaging or outpatient costs. Plans also change every year. New copays, new limits, new rules. People do the math after a few years and see the real cost, and cost is only one part of the picture. Networks matter just as much. Network issues push people to switch. A cardiologist leaves the plan, and now you either start over with a new doctor or you pay more to stay with the one you trust. In some counties, there are only 1 or 2 specialists in the network, so appointments take longer and it is harder to get in when you need care. Offices also stop taking certain plans during the year, and people usually find out when they call to book a visit. Over time, those limited choices become a real problem, especially when your health needs increase. When your medical needs increase, the copays on some Advantage plans add up fast. Seeing 3 specialists a month can reach about $1,800 a year in copays, and even a few imaging tests a year can add several hundred more. When you add those 2 pieces together, many people spend around $2,600 a year before they even get to the bigger procedures. People want predictable costs, but many wait until their needs increase and then find out they are no longer healthy enough to pass underwriting. That is why timing matters. People don't realize Medigap requires underwriting when switching from Advantage. They assume pre-existing conditions don't count. True for Medicare, but not for Medigap. Once your 6-month open enrollment window closes, you answer health questions, and approval isn't guaranteed. People also get confused about the max out-of-pocket. Something gets paid up front. Others don't realize every copay and coinsurance payments count toward that limit. State rules vary, so timing matters more than you think. People are often surprised by how Advantage billing works. The maximum out-of-pocket can be very different from one plan or county to another, and that difference matters when you have ongoing care. Outpatient services such as surgeries, imaging, and physical therapy all count toward that limit, and they are usually the biggest expenses people face. Dental and vision benefits have yearly caps, which many people find out only after trying to use them. And even though the information is available before enrolling, many people do not understand how the plan bills until they start using the benefits. Once you see it all together, the billing makes more sense. This is where many people realize their plan is working differently than they expected. I worked with someone who had been on an Advantage plan for a few years. Their primary doctor left the network, which meant finding a new one. Their specialist copay increased, and then they received an outpatient bill they did not expect. It wasn't until they added up the entire year that they saw how much they were spending. When they compared those costs to a Medigap plan, they realized they would spend less and have more flexibility with doctors. They switched during the next enrollment period. This is a common pattern. It usually starts with network changes, rising visit costs, and bills people did not expect. Now you know the 5 reasons people think about switching: rising costs, changing networks, increasing health needs, underwriting rules, and billing confusion. Understanding this before you make a change puts you ahead. If you're comparing plans, look at your total yearly costs instead of focusing only on the premium. If you're already on Advantage and thinking about switching, check your state rules and your enrollment window. The 6-month guaranteed period matters. Plan ahead and review everything during annual enrollment in the fall so you're not rushed. And if you want a simple checklist to compare Advantage and Medigap side by side, grab the Medicare Starter Kit in the description. Thank you for listening, and I'll see you in the next one.